A lot of people are looking for a way to reduce the cost of healthcare and increase access at the same time. There may be a way to do this. It's called reference-based pricing. That's what this is about. So we must start with this question of why does healthcare cost so much? And I want to tell you it's a tough and complicated answer. There are no simple answers. Anyone who says they have the best answer probably is wrong and maybe misleading you. And run as fast as you can from anybody who says they have the perfect solution. However, there are ways to control cost and reduce the price we pay for healthcare services. I'm going to explore one of those with you here today on this presentation. So let's start with, how do we pay for medical care today? How do we pay for medical care today? Absolutely, totally different from any other purchase we make. We don't know the price before we receive the care. We can pay anywhere from 1 to 10 times or more for the same thing and never know that we could pay far less. We're liable for the entire bill, no matter the charge, even if it's outrageous. Somebody else uses our money to pay our medical bills for us, and somebody else tells us where we have to go to see a provider. We don't know the quality of care that we're purchasing, even afterwards. So how do we purchase every other thing other than healthcare? We usually start by saying, what do I need and when do I need it? We know the price before we spend the money. We can shop based on price and we can plainly see the price. We're not likely to spend the money if the price is outrageous. It's our money. We make the decision. That's a key difference. We can go where we choose to make the purchase. We can get information to know the quality of what we're purchasing. Generally, we get to make the decision, and we could choose between alternatives. Why don't we know the price of healthcare before we buy healthcare services? They don't want us to know. Why don't they want us to know? Well, they don't want us to know because they don't want us to know. Does that sound odd? Think about it. They believe we're not smart enough to understand healthcare prices. It creates dependency, and they're paid to manage our healthcare. You see, big medicine has designed a complicated billing system that only they can understand and from which they earn billions of dollars, and they will do all they can to defend it. The more complicated their system is, the more items for which they can charge us and bury those charges in their bills. Their complicated system creates fraud, confusion, error, and waste. Sad thing is, we pay for it all. And when it doesn't work the way they think it should, they invent new, expensive ways to manage our care, and we get to pay for it. Once again, they earn an enormous amount of money managing our care. Essentially, there's two types of healthcare consumers out there today. One is the consumer that would want to purchase a managed care policy where someone else manages their care. And the others are those who would purchase, if they could, a self-managed care policy because they're more confident in managing their own health care. This type of person wants to be more independent with their own healthcare decisions. This type of person wants someone else to take care of their healthcare decisions. Nothing wrong with that. This consumer wants to spend more of their own money on something other than health insurance. This consumer prefers to spend more of their money on a managed care health insurance plan, leaving less for other things. This consumer wants multiple options from which to choose, and this consumer is willing to live with limited options from which to choose. Here, the provider has to satisfy the patient. Here, the provider has to satisfy the managers. Here, quality is determined by the patient based on which providers they choose. Here, quality is determined by someone else. This is all okay. It's their choice and ought to be. And this is all okay. It's their choice and ought to be. For more than 30 years, managed care, third-party managed care, has been the norm. And what has the effect been? Well, first of all, unaffordable health insurance premiums. Everybody knows that. The belief that health care should be free or inexpensive, but comprehensive and unlimited, and someone else should pay. The dumbing down of consumerism is so common in healthcare purchases, a sense of helplessness against the system, a belief that only someone else can make decisions for us. So as a result, we see restrictions on our choice of care. We see increased government control of individual health care due to the failure to control cost. Now we can choose either of these today, the old managed care industry policy or the new self-managed insurance policy. The new policy, we see all the prices. The old prices or policy, the prices are secret. The new policy, we choose our providers. In the old, others choose our providers for us. Here, we're able to know the price and get it directly from the provider. Here, we trust others to negotiate the price with providers to get us the best price. The new self-managed insurance policy gives us control over our premium based on how much we're willing to have insurance pay for us. The old managed care insurance policy, others set our premium based on the networks from which they allow us to choose our care. In the new self-managed policy, we work directly with our doctor to choose the type of care we prefer. In the old managed care policies, health plan managers instruct our doctor on the care we're allowed to receive. Administrative costs of insurance are reduced on the self-managed plans. Administrative expenses are higher on managed care plans. There's been 3 major recent attempts to reduce prices outside of government-imposed regulations. First of all, what we call patient-directed health plans. Then came price transparency. And the newest, biggest development now is reference-based pricing. In the first phase of trying to control prices, we developed patient-driven health plans. Many employers and leaders began to understand that healthcare is not free. And managed care had become so expensive, they were looking for less costly plans. And many people were overusing their insurance. They realized that expensive premiums and healthcare spending are directly related. So a growing number of people became willing to take ownership of healthcare decisions and began using the patient-driven health plans combined with health savings accounts. HSAs are only about 11 or 12 years old, and yet there's some 24 million of them today as of mid-2018. That's a lot of people using HSAs and patient-driven health plans. This is good. The second phase has been providing price transparency. Now, price transparency happens when the price a provider charges is disclosed before we use the service. Knowing the price helps us to prevent surprise price gouging that makes health insurance so costly. Price gouging happens when we pay far more than what others pay for the same service, especially more than government health plans. And data shows that a billed charge can be 10 to 20 times more than the provider will accept from a government plan like Medicare. Now we have reference-based pricing for care. This is a new, fast-growing way to pay for health care. So the next step allows us to take advantage of price transparency. It does no good to know the price if you don't have anything to relate it to. How would you know what's a fair price? So to determine a fair price requires a common reference-based price to compare with each provider's price. There happens to be a common reference-based price already used all across the country for almost all healthcare pricing, but it's been kept secret from us. The Medicare allowance is the most widely reference-based price used across the country, and it has been for decades. It's nothing new. Medicare, for those who are not sure, is the federal government healthcare system that pays for care for people 65 or older. Sorry about the 85. 65 or older, well, 85 and older too. And those certain people with disabilities under 65. So reference-based pricing makes price transparency valuable. For most healthcare services, our insurance company already pays a percentage amount based on what Medicare pays for that service. So if you were to guess, how much above Medicare do you think insurance pays on average to a Minnesota provider or a provider anywhere? Is it 10% or 50% or 100% or 150%? Well, based on a volume of data tested by Minnesota Measurements, the answer is about 187% more. That's 87% above Medicare, or Medicare plus 87%. Example, if Medicare were to pay $100,000 for surgery, our insurance would on average pay $187,000. For laboratory services in Minnesota, you'll find the average range of payment was 765%, comparing the lowest to highest charges. This is not unlike any other state in the nation. So let's take a couple examples, like testing for a complete blood count. In Minnesota, the price ranged from $6 to $74, more than 1,000 or 1,200% price variation for the same thing. The Medicare reference-based price is $9. We can find these prices, if you know where to look, on the Medicare CMS website. A blood lipid panel, a blood test, the price ranged from $8 to $179, almost 2,300% price variation. The Medicare reference-based price, $18. But you could pay as much as $179. Does that seem right? Here's some more thoughts about this. Now, if we know the percent that a provider charges in reference to the Medicare rate, we can compare the amount we'll pay to different providers. So let's say we want to get an office exam. We ask each clinic in our area, what percentage do you charge above Medicare? Clinic A says 125% above Medicare. Clinic B says 200% above Medicare. And Clinic C says, well, we charge the same as Medicare, 100%. You can choose the doctor with the lower rate, the medium rate, or the higher rate. The thing is, the value to us of the doctor's work is shown by our willingness to pay his price. Let's take an example. Pat and Jan are going to have a baby. So they do their work. They call each hospital ahead of time and they say, what percentage do you charge above Medicare? They find out Hospital A charges 150% above Medicare. Hospital B charges 300% above Medicare. And you say, that's not possible. Oh, it's absolutely possible. And there are hospitals that charge a lot more than that. Hospital C charges 100% above Medicare. So Pat and Jan have to choose a hospital. They ask their hospitals why they charge what they charge and what they're paying for and whether they have options. The value of the hospital's care is shown by Pat and Jan's willingness to pay their price. So there's new types of health insurance policies that base provider payments on the amount paid relative to a rate above Medicare. The patient's share of the payment is determined and disclosed through their insurance plan design. For example, a reference-based insurance plan may pay 150% of Medicare. The doctor's charge is $375 for an exam, let's say. And Medicare allows this $150. The plan pays at 150% above $225. That would be Medicare 150 plus 50%, which is $75 for $225. Now the patient is free to agree to the provider's price and pay the extra 150 or go somewhere else. Let's say a doctor prescribes an MRI of the liver and he suggests ABC radiology. You learn that ABC Radiology's retail price, the one they'll tell you about, is $1,895. You discover that Medicare allows $385. You'll say, are we pulling a little trick here with the numbers? Well, no, these are actually real examples. The reference-based health plan, let's say, pays 200% over Medicare. So they would pay $385 times 2, or $770. Now the patient has an option. ABC Radiology can insist on getting paid the full amount, and the patient can choose to pay the $1,225 extra, or ABC Radiology will just lose patients. ABC Radiology could accept $770 as payment in full, or both parties could agree at a different price, let's say $995, and the patient pays the extra $225 above their health plan. Or the patient can go to DEF Radiology, which charges $850 for the same MRI. This is pretty common. Here's another example. Abby Baker chose a reference-based pricing plan that pays 150% over the Medicare reference price. So she calls Doctors Jack and Rogers, and she's going to have a exam. What rate do you charge above Medicare? Well, she discovers Medicare's rate for a standard physical is $150. So knowing their rates allows Abby to become a healthcare shopper, save money, and maybe get better quality. So she talks to Dr. Jack and Dr. Rogers, and Dr. Jack says we charge 175% above Medicare. Dr. Rogers says we charge 160% above Medicare. Dr. Jack says their physical price is then $262.50, whereas Dr. Rogers' charge is $240. Abby's plan at 50% above Medicare pays $225, whether it's Dr. Jack or Dr. Rogers. So if she chooses Dr. Jack, she will pay an additional $37.50, or Dr. Jack can agree to accept $225. If she chooses Dr. Rogers, she'll pay an additional $15, or Dr. Rogers can agree to accept $225. Now the thing is, Abby may live within a mile of Dr. Jack and 10 miles of Dr. Rogers, and maybe it's worth it for her to pay the extra to stay closer to home. Or maybe she's heard that Dr. Rogers has exceptional patient relationships and high quality, where Dr. Jack is not so much. She can shop. So why would someone agree to pay more for care? Well, they would do it if they thought they were getting higher quality care from one doctor over another. That would be one reason. So let's take Dr. Old and Dr. New, who are both OBGYN MDs, and they perform an ovarian cyst removal procedure. Dr. New's data shows that 98 out of 100 ovaries can be saved using his New Way procedure, and leaves only 2 women out of 100 with 1 ovary. Where Dr. Old shows that out of 60, or that he could save 60 out of 100 ovaries using the traditional method, leaving 40 women out of 100 with only 1 ovary. Dr. New charges $1,000 more than Dr. Old to perform the surgery. Now, patients given a choice, knowing the price up front and understanding why Dr. New charges more than Dr. Old, are going to make a choice. A woman who doesn't want more children might choose Dr. Old and save money, whereas a woman wanting more children might choose Dr. New, spending more money, but knowing the chances are good she can keep her ovaries. A reference-based insurance plan can be structured in many ways, but the key feature is Medicare's allowable price serves as the common reference price. This does not mean that a provider will or should accept Medicare as the full payment for services for a non-Medicare patient. The insurance payment can be set at different rates. The more the rate over Medicare, the more expensive the premium will be. It is possible that a plan might include a deductible and other traditional insurance provisions. Okay, so for instance, a plan may pay 140% above Medicare. It will have lower premiums. A plan might pay 175% above Medicare. It might have medium premiums. A plan might pay 200% above Medicare, and it would have higher premiums. You see, the more the plan pays above Medicare or less will affect the premium. Here's some really cool things about reference-based price insurance plans. First of all, you can choose any willing provider. There are no networks. So out-of-network care is eliminated because there are no networks. There's no surprise billings for out-of-network care because there are no networks. It'll reduce the price of care because it's less costly to administer. There's fewer billing errors, and there's open competition among providers. That means the patient has a better chance to have access to quality care at a price that actually is affordable. It also encourages independent medical practices and allows for a physician-patient relationship without third-party payers or administrators in between. The patient actually becomes the manager of his or her own care. Patients are more aware of the cost of care. They understand how provider charges relate to premium. They understand how it allows for price and quality shopping for the patient's own preferred providers. Remember, no network. Puts providers on notice that they must compete for business based on quality, price, and access. And it will improve the quality of care while reducing its cost. Now, why would patients love this kind of health insurance policy? Well, first of all, it's more affordable. Affordable medical insurance with rates reduced by as much as 50% of today's premium. They can receive medical care from whomever they want to choose. No network limitations. Have I said that enough? No networks. Knowing the price of health care before receiving it. Instead of basing a decision on who's in your network, you base your decision on price and quality of care. Better access with shorter wait times. A true doctor-patient relationship. Why would doctors embrace this? Well, doctors can practice ethics-based medicine, spending more time with patients and less time checking off boxes for managed care managers. They're freed from top-down micromanaged third parties. They're freed to have independent practices. They can control their own work schedules. They can compete with other doctors to provide care, differentiating themselves from other doctors. And it greatly reduces their administrative costs. No more networks, no more multiple reimbursement schedules. Why would insurance companies love this? It reduces their administrative cost. It increases their ability to compete. New insurance companies could enter the marketplaces. They could enter markets because there's no requirement for providers to sign contracts. They could expand their markets across state lines. So, ask your health insurance agent for more information about reference-based pricing. Remember, I said at the beginning, there is no single way that's best for everybody, but this is a great answer for a lot of people. Ask how your employer or you can benefit from this great new way to buy and use health insurance to give you access, quality, and a better price. That's a winning combination.